And welcome back. It's time for our roundtable with regular Peter MORICI, professor of economics at the University of Maryland's Smith School of Business, and two who have been closely following both the Affordable Care Act and Medicare this week, SAHIL KAPUR, congressional reporter for Talking Points Memo, and Max Richtman, the president and CEO of the National Committee to Preserve Social Security and Medicare. Gentlemen, welcome to you all. First, I'm going to turn to my seatmate. There were journalists all crowded together in the alcoves of the Supreme Court. We were lucky to get a seat. But SAHIL, we couldn't always see the justices, so we had to turn to each other to always guess, was that Kennedy talking, was that Scalia? I was glad to have you as a seatmate, because this is something you have closely followed and watched for a long time and listened to many oral arguments on. Your take afterwards was, don't listen to the hype that it's just going to come down to Kennedy. You saw some daylight with John Roberts, and I did as well. I backed away from that a little bit, but you stuck with it. Where do you see a little daylight where John Roberts might come down on this case?
I think the Chief Justice was, indeed, he was aggressively questioning the administration's Solicitor General, but at the latter half of the oral arguments Tuesday, he expressed some sympathy with the administration's argument that the healthcare market is unique and it needs to be treated in a unique way. So the question is, you know, on what side of that does he come down? We didn't see that same kind of skepticism or that same kind of questioning to the challengers from Justices Scalia or Alito.
Peter, you say in a column this week, to especially the business community, beware what you wish for. You overturn this, it could lead to single payer. What was your reasoning?
Well, simply, if they find it severable, they can throw out the individual mandate, and the bill does not come down. We have a system in Maryland and in New Jersey where the insurance companies have to take all comers, pre-existing conditions notwithstanding. That's
state law in Maryland.
And they can't discriminate in terms of rate. Heck, that sounds like Obama's system to me, without the individual mandate. It does make premiums higher, but the system hasn't collapsed. Down the road, though, this will force so many people into the pool as small businesses drop out, that we may evolve into something that looks very much like a single-payer system. We'll back into it. So it's really, you know, quite a clockwork orange.
So what do you think? There's so many different ways that justices could rule. They could strike down the mandate and leave the rest of the bill. They could leave the mandate in the whole bill in case where we are. They could rule that it's not even in their purview right now to rule on it. We don't expect that. What would be the best ruling economically for the business community?
To throw the whole thing out. It's going to be very expensive for the business community to have the bill without the individual mandate, and I think that's what they're using the individual mandate to try to get that.
If that leads to single payer, isn't that worse for the business community?
They're not thinking long term, and that's why I wrote the column that I did. My feeling is the court won't do that. While the administration behaved, our constitutional lawyer president signed a bill without appropriate severability, you know, in it. But I think at the end of the day, the court is very leery of throwing out something this big in whole, the way it did major legislation during the New Deal. They remember Roosevelt trying to pack the court.
That's it, Max. A lot of people saying, whoa, to everybody who came out and immediately said, oh man, these guys were rough. It looks doomed. SAHIL wrote wisely, you know, don't be fooled by the tough questions. That's their job. This may not be thrown out just yet. You say there is cause for concern for older Americans and even those still working 50 and older and many if this law is thrown out.
There's a tremendous cause for concern for current Medicare beneficiaries and future Medicare beneficiaries. The bottom line with the Affordable Care Act is seniors on Medicare get more in terms of benefits and pay less for it. All of that disappears.
But you even wrote a list of things that people who are still in the workforce, 50 and older, you had a long list of things that you say helps them from the Affordable Care Act.
Absolutely, but the focus for us, we're the National Committee to Preserve Social Security and Medicare. And we entered, we joined an amicus brief with the National Senior Citizen Law Center to at least protect those benefits that are so critical in that bill. You know,
such as prescription drugs.
Prescription drugs, the cost of prescription drugs. You know, there is in the law since 2003, there are prescription drug benefits under Medicare, but there's this donut hole, I'm sure you've heard about it, this gap in coverage. Very unusual in an insurance plan where you have a gap in the middle of your coverage, but you continue to pay anyway. And what the Affordable Care Act does for the donut hole, it closes it. And in the meantime, while it's closing it over the next few years, it provides discounts for brand name drugs. In this area, in Maryland, in Washington, and Virginia, on average, anybody who has a Part D prescription plan and has fallen into that donut hole will save $600 a year. That's a big loss.
Though my boss asked me to make a prediction before the oral arguments even started, and I don't like to be one of those journalists who does, but before I went in, I said, you know, it would just be so unprecedented for the court to overthrow such a major piece of legislation already passed by Congress. And yet you and I heard there was lots of skepticism from the court. It is very possible they might do this. What is your prediction?
It's very hard to predict. A lot of the constitutional scholars I've spoke to said there's a good chance that this goes down, but it's too close to call at this point. What I saw at the end of the arguments were 4 solid votes to uphold the mandate, 3 likely votes to strike it down, including that of Justice Thomas, who didn't speak, but has a pretty spotless record.
But Scalia and Ito were openly hostile. You had written about how Scalia has supported the Commerce Clause before, but you and I talked to each other before it started and predicted that he would find any way he could to try and strike down this law, and it looks like he will. Right.
His misgivings about the law from top to bottom were very much on display. I don't think it would be quite a surprising turnaround after this if he turns around and concurs or
we really have 3 legislators and 7 legislators and 2 justices. There are 3 very reliable conservative votes. They're going to do exactly what the business community wants. There are 4 very reliable liberal votes who want this legislation and individual liberty be damned. There are only 2 justices really hearing this case, and
you put that as John Roberts and
absolutely, they're the only 2 people that count, and they're the only, which really throws a shadow on the court because it wasn't supposed to be this way, but it's become a legislative body.
Okay, we're going to take a break here. Come back after the break to talk to you all more. Thank you. Stay with us. Okay, this Supreme Court case is so contentious. Our roundtable is still debating back and forth while we were in the break, so let's go right back to it. Peter, you think that even though they voted on Friday, the justices in closed room, no clerks present, no one to know the outcome, we all know how the court works. Even though they voted today, they can all continue to shift positions until that time in June when we find the final outcome. And you think Roberts will try either way to side with the majority?
Absolutely. If it's a 5-4 decision to strike down, it serves Roberts' interest to go with the majority and make it 6-3, because then he decides who writes the opinion. And one of these you can do in upholding the law is construct a very tough test for this kind of mandate, so the government can't turn around and say it's broccoli. He can define what the test should be, then demonstrate how health care is special and meets that test.
And we won't even get into the broccoli because John Roberts says it's not cars, it's not broccoli, it's health insurance. It's a whole different beast, so we'll have to wait and see. I want to get to another hot button issue that was being debated this week. Sahil, you wrote about it. Congressman Paul Ryan, in his budget, says let's do away with Medicare as we know it.
So the budget that Congressman Ryan put out was very similar to his budget last year in that it replaces Medicare with a subsidized insurance exchange, very similar actually to the Affordable Care Act. But unlike last year, this version has a sort of public option that seniors can buy into with the vouchers they get, which they call, which is sort of like traditional Medicare. It does end the health care coverage guarantee, so this would be a major change. And the other important thing to note is that the value of the vouchers is going to be a little more generous this time.
So, Max, changing Medicare to be more like Affordable Care Act, but the conservatives love it. Tell us your take on what Paul Ryan has proposed.
What Chairman Ryan's budget does is allow the Medicare, those who want to buy into Medicare, to use these vouchers. But the vouchers, as has been said, are limited in their value. There's someone running for the Republican nomination for president who talked about hoping that Medicare would wither on the vine. This bill, this budget resolution, if it would, the pieces of it would be implemented and become law, that candidate's dreams would be fulfilled, because Medicare would wither on the vine with these kinds of changes.
What's the alternative? How do you fix it?
The Affordable Care Act made great advances in fixing Medicare and holding down costs and improving benefits. That's why we're so disturbed to see, you know, I don't know what the court is going to decide.
Max, I like you. The law makes a lot of promises to hold down costs. I don't believe
You know, Peter, we should give the bill a chance. You know, there are components of the bill.
I have too much respect for my individual liberty and yours to say the bill should stand. There are better ways to reform the system than requiring every American to go by.
We've talked about reforming the system for about 50 years.
And this doesn't accomplish it.
This does accomplish it.
I disagree with you.
Well,
You watch the providers game this thing. Healthcare is out of control. This bill won't solve it, and Mr. Ryan's won't either. The notion that old folks giving them a voucher are going to go out and make insurance companies bid, I think that those are the most fanciful and sophomoric proposals I've seen.
Well, you know, I would like to see the politician that can go into a senior center and say all those preventive services that you've had for the last 2 years, free mammograms, free screening for cancer, for diabetes, lower prescription drug costs, and the fact that the Affordable Care Act extended the life of the Medicare program for 7 years. We're going to take all that away. We're going to support the sweet.
Nothing is free.
I would say, you say give the bill a chance. I would say give peace a chance. But this is television. I like a good debate.
I'm for peace too.
We'll have to have. I'm not. I'm for this healthy debate we're having right here on the show.